Allopathy, homeopathy, and Ayurveda are three distinct systems of medicine that have evolved over centuries and originated in different parts of the world. Each system has its own principles, philosophies, and approaches to healthcare. In this comprehensive discussion, I will delve deeper into each system, exploring their origins, fundamental principles, treatment approaches, and critiques. Allopathy. Allopathy, also known as conventional or Western medicine, is the predominant system of medicine practiced in most parts of the world. It has its roots in ancient Greek and Roman medical traditions but has significantly evolved over time. Allopathic medicine is based on scientific principles, rigorous research, and evidence-based practices. Principles. The fundamental principle of allopathic medicine is to diagnose and treat diseases by focusing on their signs, symptoms, and underlying causes. Allopathy emphasizes a reductionist approach, considering the human body as a collection of systems and organs that can be individually targeted for treatment. This approach aims to eliminate or manage symptoms and restore health by using drugs, surgery, physical therapies, and other interventions. Treatment approach. Allopathic treatments often involve the use of pharmaceutical drugs that are developed, tested, and regulated through extensive scientific research and clinical trials. These medications are designed to target specific molecular pathways or physiological processes related to the disease or condition. Surgical interventions, such as procedures for removing tumors or repairing damaged organs, are also common in allopathic medicine. Critiques. Critics of allopathic medicine argue that its focus on symptom management and disease treatment may overlook the underlying causes of illnesses and neglect holistic approaches to healthcare. Additionally, the reliance on pharmaceutical drugs and invasive procedures may lead to side effects and complications. The high cost of healthcare, particularly in some countries, is another critique often associated with allopathy. Homeopathy. Homeopathy is a system of alternative medicine that was developed in the late 18th century by Samuel Hahnemann, a German physician. It is based on the principle of like cures like, and utilizes highly diluted substances to stimulate the body's self-healing mechanisms. Principles. The fundamental principle of homeopathy is that a substance that can cause symptoms in a healthy person can be used in highly diluted form to treat similar symptoms in an ill person. This concept is based on the belief that substances that produce symptoms in a healthy individual can, in minuscule doses, stimulate the body's vital force to restore balance and health. Treatment approach. Homeopathic remedies are prepared through a process of serial dilution and succussion, vigorous shaking. The dilution process is repeated multiple times, resulting in highly diluted substances. Homeopaths prescribe remedies based on the individual's specific symptoms, taking into account physical, mental, and emotional aspects. The goal is to match the symptoms of the patient with the symptoms produced by the chosen remedy. Critiques. Critics argue that the extreme dilutions used in homeopathy often result in remedies containing little to no detectable molecules of the original substance. They contend that any perceived benefits of homeopathy are likely due to a placebo effect. Skeptics argue that the observed effects of homeopathic remedies can be attributed to the natural course of the disease, the regression to the mean, and the power of suggestion. Furthermore, the lack of rigorous scientific evidence supporting homeopathy's effectiveness is a major critique often raised. Ayurveda. Ayurveda, which translates to knowledge of life, is an ancient holistic system of medicine that originated in the Indian subcontinent over 5,000 years ago. It places great emphasis on maintaining balance and harmony within the body, mind, and spirit to prevent and treat diseases. Principles. Ayurveda is based on the belief that each individual is a unique combination of three doshas: Vata, Pitta, and Kapha. These doshas represent different energies and elements within the body. Imbalances in the doshas are considered the root cause of diseases, and Ayurveda aims to restore balance to promote health. Treatment approach. Ayurvedic treatments involve a combination of lifestyle modifications, dietary changes, herbal medicines, detoxification procedures, yoga, meditation, and other techniques. Ayurvedic practitioners assess the patient's doshic imbalances and recommend personalized treatment plans to restore equilibrium. Ayurveda places significant importance on disease prevention, promoting overall well-being, and maintaining a healthy lifestyle. Critiques. While Ayurveda has gained popularity worldwide, there are critiques regarding the scientific evidence supporting its efficacy. Some Ayurvedic remedies may lack rigorous scientific testing, leading to concerns about safety and effectiveness. Additionally, the regulation of Ayurvedic products and practices can vary across different countries, raising questions about standardization and quality control. Conclusion. In conclusion, allopathy, homeopathy, and Ayurveda are three distinct systems of medicine with different principles and approaches to healthcare. Allopathy is rooted in scientific principles, focusing on disease diagnosis and treatment using drugs and interventions. Homeopathy utilizes highly diluted substances to stimulate the body's self-healing mechanisms based on the principle of like cures like. Ayurveda emphasizes balance and harmony within the body, using lifestyle modifications, herbal medicines, and other techniques to prevent and treat diseases. It is essential to consider that the effectiveness and safety of these systems can vary, and there are ongoing debates and discussions surrounding each of them. It is advisable to consult qualified healthcare professionals and make informed decisions about healthcare choices based on individual circumstances and needs.